Hello everyone. Many of you were asking the important topics of thorax region. I have came up with that video. In this video, what I have done, I have taken all the chapters and important topic from that. We will be seeing the important topics from the chapter wise. If you see, the first chapter is introduction. No direct question from this chapter comes, but you should at least read it once so that you will get the basics of thorax. Then there is second chapter, that is bones and joints of thorax. In this also no questions come, but you should know how many ribs are present, what are their location, what are the muscles present on those ribs. तो ये आपको पता होना चाहिए. Then directly no questions are coming from the second chapter also. Then comes the wall of thorax, the third chapter. In this, one question can be asked like typical intercostal space. The very important one is azygous vein. You should prepare a short note on azygous vein. It's very important. Any other way, you will get the question on this. Then there is typical intercostal nerve. That is an important topic. You can get an MCQ on it. Not rarely, you will get a short note on that. Then if you talk about the fourth chapter, that is thoracic cavity and pleurae. Pleurae are very important. The both types of pleurae, you should prepare a short note on the pleuras. And the blood and nerve supply of the pleura are also important. You can get a short note on this also. Then there is a thing called pleural recess and it's applied. This is very important. A short note can come on this, on the pleural recess. If we see, azygous vein is a must, pleura are the must, and its recesses are also the must question. If we see in the lungs, no direct question comes on the lung like describe right lung or left lung. Instead, a question comes on a bronchopulmonary segment of both the lungs, and they're applied also. So it's a very important question, bronchopulmonary segment. A short note very easily can come, and you have to make a diagram of bronchopulmonary segment. Then there is something, there are two diagrams given in BDC and all the books. That is the mediasternal surface of right and left lung. Those diagrams are very important. A 5-mark question can very easily come to draw the diagrams. Okay. Then there is root of lungs. Sometimes you can get a 2 marks question on root of lungs. Then there is mediastinum. The contents of the superior, middle and posterior mediastinums are very important. You can get a 2-mark question on any of these, or you can get a 5 marks describing any two or something like that. So it's a very important question, the contents of superior mediastinum, middle and posterior mediastinum. Then very important, if you get a long question from thorax region, then ultimately you will be getting from heart, that is right atrium. All the right atrium things like the blood supply also of it, all the development of interatrial septum, these questions come very often. A very important long question from thorax. Okay, and a short note can also come on pericardium also. Then blood supply of heart, all the coronary arteries, what are they are branching from and all that you should know. A short note can come, or in the viva you can get a very common question, tell the blood supply of heart. Then there is a development or embryology questions like interatrial septum development and interventricular septum development. So it's very important, you should know this. Then there can be a 2-mark question on coronary sinus also, where they are draining, where they are coming from, that also. Then there is something like chapter of superior vena cava aorta pulmonary tongue, not a very important chapter, therefore you can only get a question like thoracic aorta, not very important. Then there is last, that is trachea, thoracic duct and esophagus. So in that, the very important question is thoracic duct. It comes very often for 5 marks, so you should prepare these. So if we see once again, thoracic duct is a must question, coronary sinus, blood supply of heart, right atrium is the most important question, right? Pericardium can be asked a question. So contents of the mediastinum is very important. Then bronchopulmonary segment is very important, and the pleural recess are important. Then a zygous vein, a short note can come. So this is very small topic if you see the thorax in comparison to abdomen and other limbs. So it's very important and you can score very easily. I hope you got that, and thank you for watching.